Good afternoon. I will demonstrate the emergency management for the prolapse of the umbilical cord. First is assessment. We need to assess the woman to be transferred to the nearest consultant unit or hospital for delivery. And also, we need to assess the client's ability to follow instruction. Second is planning. I will gather all items that I will need on this procedure. For internal examination, we have clean gloves and a lubricant. For vaginal delivery, it depends on institutional setup. We have 2 sterile gloves, 1 straight forceps, 1 Mayo scissors, 1 urinary catheter, 1 placental basin, and 1 needle holder. For sterile operating sponge, we have 1 syringe with needles, 1 chromic 2/0 optional, 2% lidocaine optional, and a cotton ball with betadine. Rationale for easy accessibility for the inspection of the external genitalia, vagina, and the cervix. Good afternoon, ma'am. I am Nerina Badilla, and I will be your nurse for the day. Ma'am, may I know your name? Okay, Ma'am Anna. Ma'am, I will do internal examination to assess the progress of your labor. Is it okay for you, ma'am? Okay, ma'am. The rationale is to obtain the client's cooperation and work simultaneously. Ma'am, you will be positioned on the examination table to check for the progress of your labor. Is it okay for you, ma'am? Okay. So we have 3 positions are employed for the internal examination. We have dorsal recumbent, Sims position, and knee chest position. We will be using dorsal recumbent for this patient. So, ma'am, I will position you right now. Rationale, the aforementioned position are made best so as to expose the gynecological area to be examined. So position depends on patient's capability and for the examiner's preferred position. So ma'am, I will put the drape on you and will expose the part that I only need to assess. Okay, so the rationale is always respect for patient's modesty and provide patient's privacy. Next is I will do hand washing and I will put on the examination gloves for internal examination and will change into sterile gloves after I assess your progress of your labor, ma'am. So the rationale is to protect all healthcare provider from contracting the gynecological disease caused by highly infective organism. So ma'am, while I insert my 2 fingers, kindly take a deep breath and while I do the internal examination. So it's okay, ma'am. Let's start, ma'am. So kindly take a deep breath, ma'am. So if I see a cord that protruding on the vagina, I will handle it carefully. So, okay. So the rationale on the inspection, if the cord may be visible or the cord may be visible at the vulva, and assess the cord for pulsation. Okay. After performing internal examination, so ma'am, I will be now assessing the heart rate of your baby by putting a stethoscope on your abdomen. Is it okay for you, ma'am? Okay, ma'am, thank you. So, ma'am, stay relaxed. Okay. The rationale, cord prolapse is first discovered only after the membranes have ruptured. when the fetal heart rate is discovered to be unusual, slow, or a variable deceleration, fetal heart rate patterns suddenly becomes apparent on a fetal monitor. To rule out cord prolapse, always assess the fetal heart sound immediately after rupture of the membranes, whether this occurs spontaneously or by amniotomy. Next is if you are in a comprehensive emergency obstetric and newborn care facility, report the findings to the obstetrician for emergencies cesarean section. And if you are in a basic emergency obstetric and newborn care facility, the following procedure are the emergency management for the prolapse of the umbilical cord. Ma'am, I will assist you to a knee chest position. Ma'am, take a deep breath and do not bear down if you have the urge to do so. So the rationale is knee chest position uses gravity to shift the fetus out of the pelvis. Next, put on a sterile gloves before doing any procedure like bladder filling or manual maneuver. Ma'am, I will be inserting a catheter that will inflate your bladder by a sterile fluid to help in reducing the compression on the prolapse cord. So let's start, ma'am. So we have here a urinary catheter and our sterile intravenous fluid, assuming that this is a sterile intravenous fluid. So we need to connect it. And before inserting this catheter tip, we need to lubricate it first. So that it will easily enter to the bladder. So mom, take a deep breath. Next is we need to add a sterile fluid or inflate the catheter balloon like that. And once that there is a resistance, okay. So next is the catheter should be clamped once 500 to 750 ml have been instilled. So here you should be clamped this one. So the rationale, if the decision to delivery interval is likely to be more prolonged, and particularly if it involves ambulance transfer, elevation through bladder filling may be more practical. And a while ago, the catheter should be clamped once 500 to 750 ml have been instilled. And it is essential to empty the bladder first or again before any delivery attempt, be it vaginal or cesarean section. Next is manual elevation. Ma'am, I will put my glove hands into your vagina to push the head of your baby upwards. Take a deep breath when you have the urge to bear down. So ma'am, let's start. Note, do not remove your finger or your hands until you arrive at the operating room or by instruction of the obstetrician. The rationale, the elevation of the presenting part is thought to relieve pressure on the umbilical cord and prevent mechanical vascular occlusion. Next, I will call out the time of birth and the gender of the newborn. If the newborn is with good cry, I will proceed with EINC or Essential Intrapartum Newborn Care. If it is not crying, I will cut the cord and resuscitate the infant if needed. The rationale is to safeguard the mother and the baby against infection and to facilitate spontaneous breathing to the infant. Next is after the procedure, I will remove my gloves and wash my hands. The rationale is for infection control. And after this procedure, I will document the date, the time, and the procedure about the prolapse of the umbilical cord. The rationale is to provide accurate data in the care of the client. Thank you.